This is chapter 46 kapag sa Katzung, but I think it's a different chapter if you use the Lippincott. However, the content of my slide is a combination na of both books. Okay? Anti-cancer drugs. Sige, so what do you mean by cancer? It's not new to us, class. Cancer is also known as malignancies. And when you say cancer, there is an abnormal growth of cells. Okay, so all of us have cancer cells, and if they get activated, they will grow abnormally. Okay, we have different, we have more than 100 types of like cancer cells. Okay, na again, pag ma-activate, they will grow very fast, very rapidly, and they will grow abnormally. Unlike our normal and healthy cells. Now, if the condition, if the malignancy or the cancer spreads from one part of the body to another part, that's what we call metastasis. Okay? Metastasis yan siya. Pag nag-metastasize na, sabihin nun, nag-spread na yung cancer to another part. Now, we have patients na merong mga lump or mga tumor pero it's not cancerous. Ito yung tinatawag natin na benign. Okay? So just like example, a lump in the breast may not be cancerous. Pwede lang siyang, nandyan siya, nag-grow siya, pero hindi siya cancerous talaga. Pag cancerous yung tumor or yung lump, yan yung tinatawag natin na malignant. Okay, now how do we know if it is cancerous or not? We do biopsy. Okay, so if you hear the term biopsy, it's referring to the process of taking out a piece of tissue from a part of your body to check whether there is cancer cells or wala. Or kung example, meron kang lump or a tumor in one part of your body, the doctor will be taking out a piece of that tissue and check whether it's cancerous or not. That's biopsy. Now, what are the causes of cancer? Syempre, exposure to carcinogens. When you say carcinogens, any chemical substance that may cause malignancy in the body. So most of the time, if it is in the laboratory, the carcinogens are organic chemicals. So kapag ka kayo, I don't know, parang nag-pandemic na when you had your organic chemistry, I don't know. Kapag lang, kasi sure. Pero if you handled mga organic chemicals in the lab, you really have to protect yourselves because most of them are considered carcinogens. Actually, mga anti-cancer drugs natin, chemotherapy agents natin are also considered carcinogens. They are drugs to treat cancer, but our problem is they can cause other types of cancer. So again, they are still considered as carcinogens. That is the reason why inside the hospital, they really place this anti-cancer drugs in a secured area away from people, and they don't open it anywhere. You just open the anti-cancer drugs at the bedside when it is ready to be administered to the patient. Okay? To limit the exposure, because again, these anti-cancer drugs are considered carcinogenic. Okay? Cigars may carcinogens, yeah. Cigarette smoking. Okay. So sa cigarette class, the one that is addictive is nicotine. And the one that causes cardiovascular diseases like hypertension and problems in the heart is still nicotine. Okay? And nicotine is the one that is deposited in the teeth, kaya nag-yellow yung kanilang teeth. Pero, when you say the one that causes cancer, it's not really the nicotine. It's the tar and the benzopyrene. Let me write it in the screen. It's the tar, and at the same time, the benzopyrene These two are chemical substances that we see in the filter of the cigarette. Diba? Yung cigarette, parang divided siya into two parts. The first part is where you get to see the tobacco. And the second part is like a foam. It's called a filter. So, if you hit the tobacco kasi in the filter, this that is where the tar and the benzopyrene will be deposited, and you may inhale that one. That one will cause cancer. Okay, mouth cancer, esophageal cancer, whatever, or lung cancer. Pinakamarami. Okay? So yes, may carcinogen sa ating cigarette. Actually, siguro that is the reason why like they consider yung e-cigarette as safer because of the absence of tar and benzopyrene sa e-cigarette. But since e-cigarette, if you meron kasing e-cigarette na walang nicotine, but if you still smoke with the nicotine using the e-cigarette, you still have the risk of having cardiovascular disorders. So, ganun pa rin. Doon lang siguro tayo nagkatalo sa presence ni benzopyrene and the tar. And I just don't know. I was not able to read a lot about e-cigarette. I don't know what other chemicals they mix or they include in the juice. So I cannot really tell whether it's safer or not. Ang alam ko lang, tar and benzopyrene is in the cigarette. Okay? Yeah, that is also our problem with the development of the disease, no? The cancer or the cardiovascular disorders, they will not really manifest 1, 2 years, 3 years, even 5 years of smoking or even smoking e-cigarette. You may have the manifestation of the destruction of the organs sometime later, siguro mga after 10 years, mga anak. So, maulan gihapon. And at the same time, most who do e-cigarette smoking are, mga bata. So, basta bata ka pa kasi, yung immune system mo malakas pa, your body can compensate with, everything that goes inside, yung nangyayari, kaya pang mag-react ng body natin. Pero syempre, since nag-accumulate yan siya inside, nag-cause pa rin yan ng sakit. So, tama na siya. See you mga after 10 years. Bantay magpaamot sa Gcash after 10 years ang mukha. Ayan yun. And if you look at statistics class, marami talagang nagkakasakit after how many years of smoking. It's not just about smoking. Alcohol is also included there. Alcohol is really known to cause fats and oil deposition in the body. And that is why you have the beer belly, right? And that can also cause cardiovascular disorders. Aside from targeting your liver, you really have to protect yourselves. If you want to drink, you do so in moderation. Wag naman yung palaigit na kaayo, no? So your body cannot keep up with the alcohol anymore after some time. Okay? And at the same time, aside from exposure to carcinogens sa cancer, most of the time, yung mga cases natin sa cancer are actually hereditary. Okay? So it's in the genes. And especially if you have immediate family member, like your mother or father or your siblings mismo, if nagkaroon sila ng cancer, it runs in your blood. Okay? So yung chance nyo, yung parang risk nyo of having cancer is mataas compared doon sa someone na wala siya sa blood nila. Okay? So, tumataas ang chance kapag may family member kang nagka-cancer. Okay? Viruses and other infections, I'll show you later a list of yung viruses that can cause cancer. Meron yan. And then, ayun nga, smoking and tobacco, andyan siya. Diet and physical activities. When you say diet, it's not about going into diet ha. The diet means here, yung kinakain natin. Kasi, ano yun siya, meron ding mga halo sa pagkain natin na considered carcinogens. Okay? Especially those na mahilig kumain ng mga processed foods. Okay? So yung mga processed foods na yan ang may mga additional chemical substances, actually mostly on the preservatives na ginagamit nila. Na ano siya, after some time, it can really cause mutation in our, example, in our DNA. And ayun na, yung problem dyan. Pwede magka-cancer. Physical activities, most of the time din, yung exposure natin to some things na ginagawa natin. And at the same time, yung mga sedentary yung lifestyle, yung mga walang exercise. Kasi masyadong nagpa-function yung cell natin, hindi nagagamit. And then exposure to radiation. So, di ba, we have nuclear pharmacists who deal with mga radiopharmaceuticals. They are almost always exposed to radiation. So, at risk sila of having cancer. Sali na dyan yung mga radtech natin. They're always exposed to radiation. So, they really have to protect themselves, no? Nahirap. Mga natutulog dyan na ginagawang unan yung cellphone ninyo, you get away with that habit. Ilayo nyo naman yung cellphone ninyo. Ang problem natin, ma'am, dili makadungog sa alarm. No, naanda kong problema din, ha? As much as possible, class. Ilayo nyo naman, ha? Yung cellphones ninyo. Kasi, you know that cell phones do emit radiation. Okay? Sige. Questions? Wala? Sige. So, what are the viruses that cause cancer? Yung mga HEPA B and HEPA C, they can cause cancer leading to liver cancer, syempre. Liver cancer yan. Nangyari dyan sa camera ko. Okay. And then the HIV itself, the one that causes AIDS, can also cause Hodgkin's and non-Hodgkin's lymphoma. We'll talk about lymphoma later. And then the HPV, the human papilloma virus, especially the HPV2, kasi diba, we have two types of human papilloma virus. The HPV1, that's the one that causes, ano yan? Kalunggo. And then the other one, the HPV2, if napunta siya sa genitals, can cause, especially for girls, can cause cervical cancer. So, mga babae, be careful. And at the same time, hindi kasi siya magmamanifest talaga sa mga lalaki. But if you have contact with someone who is a carrier of HPV, babae, you may have cervical cancer. I mean, hindi talaga magkukos ng cancer sa mga lalaki, but it can manifest signs and symptoms of an STI, STD pa rin siya. And then the Epstein-Barr virus can cause nasopharyngeal cancer. Ito yung virus, diba, na transfer siya from one person to another through kissing. Yung tinatawag na kissing mononucleosis. So, nasa laway kasi siya. Tapos, if the person has this virus inside, again, natatransfer siya sa laway. Siya, dito ang kinakos niya ng cancer, nasopharyngeal cancer. The herpes is another virus. HPV is the human papilloma virus, and then si herpes is called HSV. Magkaiba sila, ha? Wait lang, isulat. This one is HPV, human papilloma. Warts ang kinakos nito, virus. Yung mga babaeng nagkakaroon ng warts sa genitals, yun yung magkakaroon ng risk of having cervical cancer. And then malalaman kasi nila yan, plus when they look at the genitals, para siyang cauliflower. Sa inside ha, hindi sa labas. Inside, titingnan yung cervix, nagko-cauliflower yung kanyang mukha. And that is an indication na merong cervical cancer. Yung herpes, ano yan? Herpes ay simplex virus. So, ang abbreviation nito is HSV. Pero we also have two types, right, of herpes simplex virus. Ang itong HPV-1, yung warts, yung like sa kamay, ganon. Ang HPV-2, warts pa rin, pero sa genitals. And then, sa mga babae, pwede siya mag-cause ng cervical cancer. Si herpes simplex virus, the HSV-1, yung herpes na, example dito sa bunganga. Ano ganyan sa Bisaya, oy? Kanang diri ko sa mga baby. I forgot. Kanang diri sa basta kanang diri sa sa side sa ilahang baba. Pwede na siya HSV-1. Pero kapag ka HSV-2, yan yung sa genitals naman. Sexually transmitted disease pa rin yun. Pero they are two different viruses, ha? And then again, the Epstein-Barr virus, the EBV virus, the one that causes kissing mononucleosis. So, hindi yun siya, class ha? Like, sabi kayo na, I'm free from AIDS, from HIV because I don't have sexual intercourse sa kahit sino. But if you like kissing people, even strangers, pwede pa rin magkaroon ng sakit dyan kasi meron nga tayong virus that is transferred from one person to another via kissing. And ang problem niyan, this virus can cause nasopharyngeal cancer. Okay? So what are the general signs and symptoms of cancer? So number 1 dyan is unexplained weight loss. Nilagyan talaga ng unexplained weight loss kasi baka naman nagpapayat lang kaya pumayat. So kapag pumayat ka class tapos like sinabihan ka na uy pumayat ka, sabihin mo talaga nagpapayat ka. Kasi pag pumayat ka nang hindi ka naman nagpapapayat, may problema ka talaga sa body mo. So one of that is cancer. Okay? Hindi lang naman solely for cancer, no? Pero isa lang doon yung reason bakit nag-weight loss. It's cancer. Okay? And then fever, nasabi ko nga yung na-proxen test kanina sa inyo, diba? May fever na hindi nawawala, hindi natatabla ng common treatment na antipyretic natin. Tapos kapag nawala siya using the naproxen, it might be an indication of cancer. And then fatigue, though fatigue class is true to all diseases, no? And then there is pain to the part, kung saan mang part ng body yung cancer mo. Skin changes, especially if it is a melanoma, we'll define melanoma later. And then change in bowel habits and bladder functions. Kasi you know naman, diba, your normal na pag-ihi, normal na pagbawas, pag nagkakaroon ng changes dyan. Tapos, especially if it's chronic, you really have something wrong with your body, especially your gastrointestinal tract. And then we have sores that do not heal. May mga sugat kayo dyan na hindi nag-heal, umiitim na siya. Ayan, indication yan. Iba din naman yung source sa diabetic ha, matagal talaga din mag-heal yun. Pero it's another case. White patches inside the mouth or white spots in tongue, especially for smokers, will tell you na the patient might have mouth cancer. Okay? Or like sa nasopharyngeal na cancer. Unusual bleeding or discharge, not just for girls, pwede din itong sa lalaki. Thickening or lumps in the body, like magkapakapa ka ng breast mo. Ayan, pag may makapa ka dyan na unusual, supposedly wala kang makakapa talaga. Ayan, that may be indication, but take note ha, na hindi lahat ng lumps ay cancerous. Some of them are benign. And then recent changes in warts or moles, especially yung sa layman's term na tinatawag natin na buhay na mole ha. Mostly kasi yan yung cancerous. And then nagging cough or hoarseness sa voice. These are signs, general though. These are general signs and symptoms of cancer. Now, how do we classify our cancer? We have here carcinoma, melanoma, lymphoma, leukemia, and sarcoma. Isa-isahin natin sila. Now, pag carcinoma class, ito yung mostly cancer na yung kung i-rank natin silang lahat, ito yung pinakamarami. Okay? Yung carcinoma. So, saan sila nag-originate? Sa skin, sa lungs, or sa breast, mga carcinoma yan sila lahat. Pancreas and other organs and glands. And ang common talaga sa carcinoma is the abnormal growth of cell starts in the epithelial tissues. Remember in your anatomy and physiology, when you say epithelial tissues, yan yung lining ng isang organ. Cells na nasa lining ng organs. Diyan magsa-start yung abnormal growth. Yan yung indication na it's a carcinoma. Okay? So just like this one. So this is an example of a basal cell carcinoma. It's a different type of cell, but yeah, there is still an abnormal growth. And then this one is called a squamous cell carcinoma. Or this one, this is a breast cancer. This is again a carcinoma. It involves the epithelial cells that line here, nagla-line dyan sa part ng body na yan. Okay, so it will manifest like this one for the breast cancer. So again, it's a type of carcinoma. Now, how about the melanoma? Melanoma is in the pigment sa skin. Okay? It arises in the cells that make the pigment of the skin. So just like this one. So this one is benign though. The other one that is color black is malignant. Okay? So yung common talaga, yung kapag ka nagbabago nga yung kasi sa mole ito class, for example, may mole ka ha, tapos nagbago yung kanyang mukha, yan yung parang indication niya. Okay? Sige. And then we have lymphoma. So si lymphoma naman, cancers ito sa lymphocytes. Okay? So 'di ba, we have the lymphatic system that is involved in our immune system. And most of the lymphoma class starts in the lymph nodes. So ito yung mga parts ng body na involved in the lymphatic system. So you have lymph nodes all over the body. 'Di ba makakapa mo naman kapag lumaki yung lymph nodes mo? Kasi sa tawag sa Bisaya, ana, kanang diri sa likod sa Mandalungan. Nasa nga sa Bisaya class, kanang diri. Oh, I forgot. Why do I forget a lot of things today? Bakit yan? Ano nangyari? Nasa Bisaya na. Kanang, I just know it's a lymph node though. Pag magkasakit ka, di ba, parang nakakapa mo siya dito sa likod ng iyong neck. Kaya sa ilok, makapa mo din yan, and even sa singit mo. Kaya yan, meron dyan groin. Yan yung mga lymph nodes na yan. Nagre-react kasi talaga yan when you have, for example, may sakit ang ulo mo, or may fever ka, lumalaki talaga yung lymph nodes dyan. Pero kapag ka nawawala yung sakit mo or even yung injury sa upper part ng iyong body, nawawala din naman. I mean, nawawala din naman yung inflammation of the lymph nodes. Ang problema natin kapag lumalaki talaga siya and then just like this one, nagmamanifest na talaga siya, no? Ayan yung tatawagin nating lymphoma. Okay? Hindi ko katulugan kung hindi na ma-remember sa tawagan na sa Bisaya. And aside from that, anyway, we have other parts of the body like the spleen class, which is included in the lymphatic system. No, the tangkugo is the nape. Wait, hindi ko makatulog. Time first, mga tanatan. Lusay day class ay kalagot oy. Lusay ba lusay? Ayun o lusay. Lusay class, 'di ba? Magdako na siya din hiyo. Pag nakay sa mud, for example, even sa singit mo, lumalaki yan kapag mayroon kang injury sa like lower part of your body. Ay, ang lusay sa inyo ha kay napiang. Like, naunsa? Like, naunsa? Like, naunsa? Nakakapa mo kasi siya dito talaga sa likod ng ano, likod ng tenga. Like napiang siya tapos mudako ang lusay dire sa likod. Pwede din siya kasi pag napiang ka, injury man pa rin yan. So magre-react pa rin ang immune system mo niyan. So lumalaki yung dito. So parang may bukol sa likod ng tenga. That's lusay. Pero included yan siya. Like ito, mga nodes kasi yan siya. Marami tayo yan dito sa body. And nagre-react yan siya during infection or during injury. Pero if you have overreactive lymphocytes or lymph nodes, ayan yung magkukos ng lymphoma. Oh, normal. Normal yan siya kapag ginalagnat ka, madakoy mo hang lusay. Normal na siya. Ang dili normal, kung wala na siya ni gamay, humanay mong lagnat, hagbayra, pero wala pa gihapon siya. Wala, ayaw lang siya hilabti. Wala lang na. Mawala lang na siya. Wala ginahimo ana. Okay. It means your body is reacting like immune system. Your immune system is working. That's the work of the lymphatic system. Okay. Pero if the activity gets abnormal, the cells in the nodes, in the lymph nodes become abnormal, ayun na yung cancerous. Ang tawag natin dyan, lymphoma. O pwede. Pwede siya na una na ang lusay mo tapos after that, pwede siyang maging indication na there is something wrong in the body. It might because na ay infection. Tapos later part pa magtaas imong body temperature. Pwede siyang mauna kasi again, ano yan siya, sa immune system natin yan. Okay? Now, how about sarcoma? So, si sarcoma naman is on the soft connective or mga supportive tissues natin. Yung cells kasi kanina yung carcinoma ha. Carcinoma sa cells, especially the epithelial cells that line an organ. This time, connective tissues na talaga like yung bones natin, yung muscles, fats, and even cartilage. So, kagaya nito, we have here sarcoma of the hand. Okay? So, sa muscles yan siya dito. Sa kamay. Sarcoma ang tawag dyan. And then lastly, leukemia. You know this. Leukemia is the cancer of the blood. So, wala usually solid tumors unlike sa sarcoma, unlike sa other na like lymphoma, may mga solid tumors kasi yan sila. Si leukemia is wala usually solid tumors. You will just see manifest, magma-manifest lang yan siya. Example, magpa-blood analysis kasi BC. And then makikita siya na you have very high level of your white blood cells. Okay, so these are the signs, the common symptoms of leukemia. So systemic, it includes weight loss, actually all of the cancers involve weight loss. And then there is fever and you have frequent infections. And then magmamanifest din siya sa lungs. Remember, sa blood itong problema na ito and your blood class is circulating all over your body. So marami talaga siyang effect. Sa lungs, you will experience SOB, mahirap huminga. And then you will have muscular weakness. There is pain or tenderness sa bones or sa joints mo. Psychologically, you will feel fatigue most of the time. You don't want to eat. Yung lymph nodes mo may swell. Ano nangyari dyan? Bakit siya nagsulat mo na siya? Kasi nagsulatan na. Wala ko nagsulat. Ano man na? Si Robles. Makuratan man sa tao eh. Anyway, again. Kurot mo na I read. Again, unsa ito? So again, your lymph nodes will have swelling kasi nga your immune system is like reacting. And then there will be enlargement of the spleen or the liver. The liver and the spleen are also included in the lymphatic system, ha? So it is involved also in the immune system. And then the skin. The patient will experience night sweats. Pwede sila, parati silang may yung common natin nakikita sa leukemia, may parati silang pasa. Kung hindi pasa, constantly they have purplish patches or spots in their skin. Okay? Kita niyo yung purpurea. Ako kasi I have that. I have brittle capillaries. If like, yung bag ko, for example, mabigat ang bag ko, lalagay ko siya dito sa arm ko. Hindi ko siya hahawakan sa hands ko, sa arm ko talaga. Tapos, I will be like that for like a long period of time. Pagtanggal ko niyan sa bag, may purplish spots na ako, purpurea na ako sa kamay ko. Pero that is because I have brittle like capillaries. Madaling mag-break yung mga capillaries, kaya nagkakaroon ng spots. Blood kasi yun, nagka-clot. Pero sa kanila, they always have this purplish spots and madali silang mag-bruise. Madali silang magkakapasa. Okay? So, yun yung mga different types of cancer. Questions before we'll move on to cancer chemotherapy. You may send your questions in the chat box. Wala? Sige, kung wala, let's move on to our cancer chemotherapy class. Our goal for cancer chemotherapy is to cause death or kill, in simpler terms, kill these cancer cells. Okay? Yan yung goal talaga natin, and at the same time to arrest tumors progression para hindi na siya lumaki pa in the case sa mga solid tumors. Okay? So, yan yung chemotherapy. They are lethal sa ating mga cells. They can cause cell death or apoptosis. Apoptosis is programmed cell death. So again, the goals of treatment, the ultimate goal is to really cure cancer. And at the same time, the curative activity should be long-term kasi our problem with cancer, nagre-relapse yan siya. Example, you are a survivor of bone cancer. Ang problema, after pila ka years, magkaka-cancer ka na naman, pero it's not bone cancer anymore, pwedeng sa ibang parts ng body na naman. Okay? Yun again yung problema natin with cancer. So, the treatment should be long-term and disease-free yung survival ng ating patient. But, in some cases, especially if yung matagal yung diagnosis, pag-diagnose ng cancer, parang stage 4 na siya kaagad, most of the time, the cure is unattainable. So, yung goal will become control of the disease only. Or, mga advanced stages na ng cancer, palliation na lang. When you say palliation, yun bang, kung ano yung symptom na na-experience ng patient, yan yung iti-treat natin para hindi naman siya mag-suffer. So for example, the patient experiences pain, inibigyan na lang natin siya ng pain reliever. Kaya lang, syempre, hindi na natatablan because cancer's pain is a severe pain. Hindi to natatablan ng NSAIDs, yung mga normal natin na mga analgesics. So, kailangan na nito ng narcotic analgesics like morphine. So, yun na lang yung binibigay natin kapag ka-advanced stage na yung cancer. Hindi na talaga nagbibigay ng chemotherapy, okay, na very aggressive. Now, we have here indications of chemotherapy. Ginagamit natin si chemotherapy class if the neoplasm, the cancer is already disseminated. It has spread to a big part of the organ, or it has even spread to another organ, and yung cancer niya is hindi na pwede ang surgery. Okay, so yan yung time na nagbibigay tayo ng chemotherapy. So we have 3 types here: adjuvant, neoadjuvant, and maintenance chemotherapy. So starting from adjuvant chemotherapy class, this is the chemotherapy used as a supplement treatment to attack micrometastasis following surgery and radiation treatment. Okay? Now, itong adjuvant therapy, for example, nag-surgery pa ang patient, kinuha yung solid na tumor, and at the same time, nag-radiation therapy pa. Iba yung radiation therapy sa chemotherapy, ha? Pag radiation therapy, talagang the use of radiation yon. Pag chemotherapy, ito yung mga drugs natin sa cancer. So I hope clear yan siya para hindi mag-mix up. Now, after the surgery and the radiation, para hindi mag-metastasize, kasi may maiiwan kasi yan siya ng mga cancer cells. And yun ang problema natin, yung mga cells na ito can metastasize. So, pwede silang mag-spread. Binibigyan natin sila ng adjuvant chemotherapy to prevent the spread. Okay? Tapos, pag sinabi namang neoadjuvant chemotherapy, though ang chemotherapy talaga is para sa mga severe form na hindi kayang i-surgery, no? Pero merong mga cases class na pinapashrink muna nila yung solid tumor before sila mag-surgical procedure. Ang tawag dyan is neoadjuvant chemotherapy. Again, the goal is just to shrink the solid tumor or the cancer. Tapos after that, i-excise na siya. Kukunin na yung tumor through surgery. And meron din tayong tinatawag na maintenance chemotherapy. So ito yung gamot, chemotherapeutic agent na binibigay at lower dose to assist in prolonging a remission. So for example, nag-declare yung doctor na the patient is cancer-free, but pwede siyang bigyan ng maintenance na chemotherapy at low dose only. That is just to prevent yung, sabi ko kanina, na nagre-relapse kasi yung cancer. Okay? So, para hindi siya mag-relapse pagkatapos na i-declare ang patient ng cancer, naayon na siya. Bigyan natin siya ng maintenance chemotherapy. So, ito yun sila lahat. Okay? Now, we have here tumor susceptibility and growth cycle. Meron kasi tayong dalawang klase ng chemotherapy drugs or chemotherapy agents. Meron tayong cell cycle specific na drugs and meron din tayong cell cycle non-specific na drugs. So, dito tayo babalik sa lesson nyo sa botany or sa inyong anatomy and physiology or lesson na to bisag elementary ta katong cell cycle, interphase, prophase, metaphase, anaphase, and telophase. Kasi kapag ka cell cycle specific ang drugs, dyan siya sa mga phases na yan magte-take ng action. Siyempre, yung non-cell cycle specific, yan walang pakialam dun sa cell cycle talaga. Okay? And then the doctor will also consider the growth rate of the tumor in giving the drugs, the chemotherapy drugs. So ito yung sinasabi kong cell cycle class. Assignment na po sa inyo you have to read again anong nangyayari during the cell cycle. So we have 4 phases here, major phases of the cell cycle. So we have here, you know this, the interphase class, actually mahaba yan siya ang interphase. So di ba nung nag-learn tayo ng IPMAT ng cell cycle na ito, parang si interphase, dinadaan-daanan lang siya, na basta nagpa-prepare yung cell sa pag-divide niya. Kasi sa cell division ito. Pero actually, medyo mahaba yung ating interface. It has first growth phase, wherein there is growth of the cell mismo, and then yung mga normal metabolic roles niya nag-happen dyan. Later, isa-isahin ko yan. And then, tapos may synthesis phase na yan. Diyan mangyayari yung DNA synthesis. And then pagkatapos ng DNA synthesis, may second growth phase pa siya. Mag-grow pa rin yung cell and that's the time magpa-prepare na siya for mitosis. So we have G1, S, and G2. All of them happen during the interphase. But for the mitotic phase, dito na lahat yung prophase, metaphase, and anaphase, and actually the telophase. Okay? If math. Again, yung assignment ko sa inyo, basahin nyo ulit ano nangyayari dito sa prophase, sa metaphase, anaphase, and telophase. So ito, the G1S and the G2, ano lang ito ha, sa interphase lang ito. So hindi kasali si mitosis. Si cytokinesis is the, meaning ng cytokinesis is the actual division of the cell. So si G1, sabi ko kanina ang pangalan ng G1, growth and normal metabolic function. So there is growth of the cell, there will be production of cellular contents excluding, so except chromosomes. Hindi nagdo-duplicate dito ang chromosomes. But all the other needs and like chemicals inside the cells are duplicated, nagpo-produce. And then, yung chromosomes kasi, yung DNA synthesis, mag-take place kasi dito sa S phase. Kaya siya tinawag na S phase kasi it means synthesis. After na-duplicate yung 46 chromosomes natin, kasi we are talking about human chromosomes here, there is the G2 phase, the second growth phase. This is where the cell double checks the replicated DNA kung tama ba, kasi kung may mali, di ba ang tawag natin dyan ay mutation. So, para kung makorek pa, if pwede pang makorek, kung kailangan ng repair. And after that, there will be mitosis. So that's the PMAT, prophase, metaphase, anaphase, telophase. And then after the telophase, kasi si telophase hanggang cleavage lang yon. Diba? Mag-cleavage yung cell preparation for the division. The actual division is called cytokinesis. GO is the death of the cell. And for the cancer cells, ito yung ating gusto. Mamatay yung cancer cells. Hindi yung ating healthy cells yung mga healthy body cells natin. Yung cancer cells. Now, please take note of the drugs considered a cell cycle or non-cell cycle specific. Under sa cell cycle specific drugs, we have the following. Number 1, anti-metabolites. And then, marami masyado yung anti-metabolites. So, we'll talk about that if I still have time later. And then, bleomycin. Number 3 is the vinca alkaloid. Ito yung yung galing sa Acaranthus roseus. Ano nga yan? Periwinkle. Ano yan sa Tagalog? Chichirica. Okay? Yung flower, yung parang damo na may flower na different colors. Yung may yellow, violet, etc. So, meron tayong kinukuha dyan na anti-cancer drugs. We call them vinca alkaloids. And they are cell cycle specific, meaning yan, yung mechanism of action nila is nandito lang. Okay? Either sa mitotic phase or dito sa interphase. Let's know that as we go on with our lesson. And then we have the etoposide also. Now, if the anti-cancer drug or the chemotherapy agent is a cell cycle specific agent, it is effective in high growth fraction malignancies. Yung mabilis dumami na cancer cells, as in mataas talaga ang fraction pag dumami siya. So ano example niyan? Hematologic cancers like leukemia. Mabilis talaga class ang leukemia. So pagka for example leukemia, hematologic cancers, ito yung ginagamit natin, cell cycle specific drugs. Even the lymphomas are included here. Okay? Now, kapag ka cell cycle non-specific drugs naman, we have here the alkylating agents, our antibiotics. So do not confuse antibiotics na kay basig ang inyong thinking pag antibiotics antibacterial lang dyan siya. No. We have to be specific. Para sa bacteria, let's call them antibacterial antibiotic. Okay? Kasi they are for bacteria. Pero antibiotics sila kasi they are taken from a microorganism. Just like penicillin. Penicillin is taken from the mold called Penicillium notatum. Okay? Diba yun yung ibig sabihin ng antibiotic? It's a substance taken from a cell. So it can be a microorganism and it has the ability to kill another type of cell. So in this case, sa penicillin for example, galing siya sa molds pero gamot siya sa bacteria. Kaya tinawag siya antibiotic. Kasi it's synthesized in the laboratory, hindi mo siya pwedeng tawaging antibiotic. Kagaya ng ating mga sulfonamides. Sample, cotrimoxazole na ginagamit natin for UTI, pag first attack ng UTI. Hindi yun siya antibiotic. We just call it antibacterial agent. But take note that we also have chemotherapy agents that are considered antibiotics. Why are they considered antibiotics? Because they are taken from one type of a cell. It can be a microorganism, a plant cell, or a human cell. And it has the ability to kill the cancer cells in human. So, antibiotic pa rin ang tawag sa kanya. Pero hindi siya antibacterial ha, chemotherapeutic agent siya. And then we have cisplatin and nitrosoureas. Itong mga cell cycle non-specific drugs, ito yung effective, pero both siya for low and high fraction malignancies. You know the high fraction malignancies, yung mabilis class mag-proliferate, mabilis dumami. Hematologic na mga cancers like yung sa lymphatic system natin and yung sa leukemia. Pero yung solid tumors kasi, kagaya nung tumor sa hand kanina na sarcoma, considered kasi yan siya as slow growth fraction. Though abnormal pa rin naman yung pagdami ng cell, but compared to the hematologic disorders, mas slow yung kanyang rate sa pagdami. So, mga solid tumors natin, mostly ito yung ginagamit natin. The cell cycle non-specific agents. Okay, what time is it? Still have 15 minutes. Questions? Or clarifications? Wala. Okay. Okay, so treatment regimens and scheduling. Ang pag-treat ng cancer, if you are going to use chemotherapeutic agents, follow the log kill phenomenon. Ang ibig sabihin ng log kill phenomenon, kung gaano kalaki yung dose na binigay mo, you are expecting na ganun din kadami na cells, na cancer cells ang mamamatay. That's log kill phenomenon. That's our goal in chemotherapy. Most of the time, it's 5 log kill. Yung goal talaga ha, yung parang times 5 yung mamamatay na cancer cells. Kasi kailangan nating bilisan kasi mauunahan tayo ng pag-proliferate ng cancer cells. And at the same time, sa treatment protocols ng ating chemotherapeutic agents, yung mga oncologist natin, meron silang protocols na tinatawag. Usually, they give combination drugs. Mahirap kasi pag isang chemotherapeutic agent lang yung ibibigay sa patient. Mahirap yun siya. Kaya kapag someone undergoing chemotherapy, makikita mo talaga doon na marami yung pinapainom. Okay? Kung hindi yan siya marami, meron siyang like interval. Ngayon, ito muna, after 2 buwan, 5 buwan, iba na naman. Combination pa rin ang tawag doon. Okay? So, bakit ginagawa nila yung combination ng mga drugs natin? To provide maximal na killing of the cancer cells. And then, yung dose niya hindi masyadong malaki. And yung toxicity matotolerate pa ng patient. Okay? And if you mix kasi the drug, if you combine the drug, you will have parang broader na action of cancer cells. Maraming types of cancer cells ang pwede niyang mapatay. Okay? And may delay or prevent the development of resistant cell lines. Okay, that's one problem that we have for cancer. Kasi nagiging resistant din siya sa chemotherapeutic agents. So, kagaya ng mga bacteria class na nagiging resistant sila sa antibacterial agents, ganun din yung mga cancer cells natin. Nag-undergo ng chemotherapy yung patient natin, tapos kapag isang klase kasi ng chemotherapy yung gagamitin, resistance agad siya. Whereas kung i-combine mo sila, little of this and then another drug na naman, hindi basta-bastang nagiging insensitive yung cancer cells sa treatment. So that's one reason why we combine drugs. So we have an example here of a treatment protocol. We have here the R-CHOP. We call this R-CHOP because it's combination of 5 drugs. We have the rituximab, and then the cyclophosphamide, and then we have the hydroxydaunorubicin, basta-basta ang mga name, no, kasi dili sila common. Dili parehas sa inyong karon nga sa community. Wala magud kayo cancer drug sa community, so dili gini siya common. And then we have the combination of oncovin, vincristin. This is not a combination, that is the brand of the vincristin, the oncovin. And lastly, merong prednisone. Pero prednisone is not an anti-cancer drug, kasali lang talaga siya dyan as an immunosuppressant kasi ginagamit ito for non-Hodgkin lymphoma. So, it's one type of lymphoma sa immune system. Meron na kasi junk factor sa Hodgkin. May nakikita sila sa cell na parang factor, the Hodgkin na factor. So kung meron yun, yan yung tinatawag nilang Hodgkin. Pero pag wala, it's non-Hodgkin lymphoma. And for non-Hodgkin lymphoma, this is our treatment protocol. Ito lahat yung binibigay nila na drug. Pero hindi ito sabay-sabay binibigay. Though it's a combination, pero hindi siya kagaya sa like hypertension na polypharmacy sabay-sabay iniinom. Ito, we have a schedule. Okay? Usually 21 days apart sila. So we give first the rituximab, nakapasunod yan siya. Rituximab una, and after 21 days, we give the cyclophosphamide and so on. Okay? That's the example of a treatment protocol and how we combine our anti-cancer drugs. Okay? To have the maximum activity of these drugs to kill a lot of cells, and then mababawasan yung kanyang toxicity, no, matotolerate lang siya ng patient, and madedelay yung or prevent natin yung resistance. Okay? Kasi again, yan yung isa sa problem natin associated with chemotherapy, the resistance, especially yung melanoma natin, yung cancer na nag-originate sa cells that produce the melanin, yung ating pigment sa skin. Yan yung parang type of cancer na madaling maging resistant. So, ang ginagawa natin sa ating cancer chemotherapy, most of the time, it's just short-term pero intensive. And then, kagaya ng R-CHOP, magiging intermittent therapy siya na combined yung drugs sa maraming drugs pero intermittent. We have intervals. Okay? And then, meron tayong tinatawag na multi-drug resistance, which is caused by P-glycoprotein. I don't know if you have discussed this one in your Pharm Chem 2, but P-glycoprotein is a part of the cell na para siyang kontrabida class. Ang work niya talaga in the cell is kontrabida. Kasi 'di ba, may mga receptors tayo na nasa loob ng cell. So ang drug kailangan niyang pumasok inside para makapag-interact siya sa kanyang receptors and makapag-elicit siya ng kanyang effect. Now, ang problema kasi ni P-glycoprotein, kapag andun yan siya sa cell, kinikick out niya kasi yung drug. Nakapasok na yung drug, tapos sisipain niya palabas. Pinapalabas niya yung drug. That's the usual cause of multi-drug resistance, the P-glycoprotein. Yeah, actually, kung titingnan talaga natin, it's a protective activity kasi the drug is considered non-self. Hindi kasi talaga siya part ng cell, di ba? So, it's like a protective activity, no? Sa P-glycoprotein. Pero kasi, kailangan natin ng effect ng drug. Kaya tinawag natin siyang kontrabida. Isipan niya palabas yung drug. Hindi na tuloy magkakaroon ng effect. And syempre, the toxicity. Problema din natin yan siya sa chemotherapy. We'll talk about that later. And then, kasama sa toxicity, yung sinabi ko kanina na the anti-cancer drugs are also considered as carcinogen. Kasi nagtitreat sila ng cancer pero nag-i-induce na naman sila ng another form of cancer. So we have here treatment-induced tumors, especially for our alkylating agents. Usually, ang nagkakos ng tumor din, yung mga alkylating agents natin. Di ba marami tayong types, no? Meron tayong cell cycle specific drugs, ito yon. And then, the cell cycle non-specific agents like the alkylating agents, ito yung notorious of causing cancer also. Nag-i-induce din siya ng another form of cancer. So siguro dito tayo mag-e-end common adverse effects of our chemotherapeutic agents. We have severe vomiting. Yan yung problem, no, pag nag-work ka sa hospital tapos merong nagko-chemotherapy, aawa ka na lang class kasi grabe, magsigigid na sila og suka. So dinha mo sulod ang ato ang paghatag og anti-emetic agent. So just like our metoclopramide. Sa brand name of metoclopramide, yan, what's the brand name, common brand name of our metoclopramide in the market? Maxolon. I'm not familiar with Maxolon. Pero yung pinakauna niya na brand. Let's check the Maxolon. Yeah, it's still metoclopramide, but the other one, the parang innovator drug niya is si Plasil ha. Si Plasil yung parang innovator drug niya. Yung parang first talaga. Innovator drug. Okay, Plasil, metoclopramide. But aside from metoclopramide, antiemetics to sila ha. We also have the granisetron, and the ondansetron. Yeah. Mga nag-end sa setron, mga ano din yan sila, anti-emetic, used especially for our cancer patients para after chemotherapy, dili sila magsigig, suka. These chemotherapeutic agents are very strong class that this will affect also healthy cells. And that is the reason the severe vomiting, the stomatitis. What do you mean by stomatitis? Itis means inflammation. Inflammation where? Siyempre, hindi stomata. Wala tayong stomata. Ang plant lang ang meron stomata. At is stomatitis. Jud ng hulapon ba? Kaya kapag sa inyo gikan ng answer, di mo makalimatan na. Okay, very good. It's inflammation sa mouth. Okay, ang stomatitis. And then there will be bone marrow suppression. Remember sa bone marrow, that is where we produce our red blood cells, some of our white blood cells. If there is bone marrow suppression problema talaga yon, the patient may experience anemia also. Then alopecia, natatanggal yung mga buhok nila, hindi lang sa ulo ha, pati ibang parte na may buhok, kilay, armpit, wherever, natatanggal din. Kasi remember, namamatay din yung healthy cells. So in that part, namamatay yung healthy cells dyan, kaya wala nang kakapitan yung buhok na huhulog. Okay? Now, bladder toxicity, this is for cyclophosphamide. Ano lang ito? Parang specific. Specific siya for cyclophosphamide, maapektuhan ang ating urinary bladder. Okay? And cardiotoxicity sa doxorubicin. Okay? And pulmonary fibrosis naman for bleomycin. Reason bakit may severe vomiting? Okay, kasi si chemotherapeutic agent kasi, di ba sabi ko kanina, naapektuhan niya din yung healthy cells. And at the same time, si chemotherapy kasi is a foreign agent. And yung iba sa kanila dito, taken by mouth ha, meron ding iba na taken parenterally. So yun kasi, yung mga drugs na ito are foreign, considered foreign in our body. So our gastrointestinal tract will send signal sa ating brain na there is class of foreign material in our body and our body should get rid of it. So yan yung reaction ng brain. Pag natanggap niya yung message na yan, ibabalik niya yan sa gastrointestinal tract and yan siya, causing the gastrointestinal tract to contract rapidly, yung peristalsis niya mabilis. So ang ending yan, vomiting. Okay? Sige. So please take note ha, may inisa-isa ko dito kasi board exam questions ito sila. Cyclophosphamide will always affect the bladder. Si doxorubicin is an antibiotic na chemotherapeutic agent. Siya naman is notorious of destroying the heart. And then si bleomycin is on the lungs. Okay, please take note of that. Now next meeting, it's already 4:30. Magsa-start na talaga ako sa drugs, no? Starting with the anti-metabolites. I'll start with the cell cycle specific agents. Medyo mahaba-haba pa ito. We are still on the 39th slide. Sabi ko, this is 119 slides. Laban Japan.